Hey everyone, welcome to Collab Conversations, the podcast dedicated to sparking dialogue and meaningful conversations about the invaluable role of patient advocacy. I'm your host, Sabrina Hanna. I'm thrilled that you're here. And I've got with me today Alvina. Alvina, actually, I don't even know your last name, but I'm going to let you introduce yourself and tell everybody about you.
Hi, I'm Alvina. The last name is Nadeem. So I am an ovarian cancer advocate. I'm also a change management consultant and coach. And I started off as an engineer, so I'm just one of those people that likes to learn things. So I have my hand in a bunch of stuff, if you will.
We were at a conference together last week, and I think you said it at that conference, but I know that you and I have had these conversations offline as well. And I love that when you say that a person living with a disease is more than just a person living with a disease. Like you just said, your background is an engineer, you're a change management consultant. So like this plays into your capacity as not just a patient, but as a patient advocate. So let's talk about that.
Yeah, no, for sure. I feel like and I totally understand it. I feel like unless we can't, it's hard to think of all of the aspects of a person. Like, for example, like, if you're a doctor, I mean, it's hard for you to also think of your patient as all the other things they are in that moment in those interactions. So
Mm.
although it's hard, I do think there's value in reminding people that, the person in front of you is a whole person. They happen to have a disease, but they're a whole person. And so when it comes to advocacy, I think that it's an untapped resource also because, like you said, like someone like me where I'm interested, I'm curious, I'm actually, reading up about the disease maybe more than other patients are because not everybody chooses this route and I respect that. But for me, it was my way of empowering myself and of my way of just educating myself like, okay, what is ovarian cancer? How does this work? And how can I get involved and all that? And then immediately my mind went to, well, how can I put my background to use and help this space evolve or change, or what can I do to like, make an impact essentially. And I think that making an impact is something that regardless of who you are, it's like a deep human need. Like we all want to have some kind of impact, right? So that being said, it's all about me saying, hey, patients are more than patients. We are XYZ. Plus, yes, we happen to have this issue and we're living with it or dealing with it, but listen to us beyond the experience of the disease, beyond just my symptoms and all that. But maybe I can bring something to the table and not just be like that, the token or the poster to show representation, but also other things that I can bring to the table.
Yeah. So there are two things that you said in that little discussion. One is that the doctor is also a person, which I think like people forget at the same time. Like the doctor sees you as a patient, but you also see the doctor as a doctor and not, maybe also having been a cancer survivor or whatever else is going on in their life. And then the other, so you're talking about like impact. And so with your engineering background and your change management background and your coaching background, how how do you impact cancer or advocacy?
So yeah, so one thing that I really I think that well what interests me really is figuring out ways of, okay, well, what are some of the issues that I see from my perspective as someone that's Pakistani, born in Pakistan. I immigrated here even though I was 7, and I'm very close to that. Those feelings still exist. I still hear those discussions of mistrust and things like that when it comes to healthcare in my community, and even with my parents and other family members. So those are some things that really immediately came to mind of like, well, how are we getting um, this message across to communities that are, a little worried, or maybe not worried, but like to have a trust issue, let's say, with the medical system or healthcare and all that. And so then it goes into topics of like EDI and all this. And so this is where I'm like, okay, well, I can speak to that from experience, like personal experience, but also from the change management side, because change management is all about, you know, looking at your picture, figuring out what are the different things that are connecting together and the flow of things, how we change and what are the different impacts. So you're kind of dissecting the problem into different aspects and not just thinking of solutions immediately, but actually going into the empathy and trying to figure out, well, okay, well, what's going on, and trying to understand your audience. And it's all about creating patient focused or user focused solutions. And so I saw that in in my work, where in my work it's not a healthcare environment, it's all tech and all that. And so, but what I took from that is that all of the things that we do, it's called user-centered, human-centered solutions. And so it's all about the user experience, right? So for me, immediately, like as I got involved in patient advocacy, my brain went like, okay, you got to put these two worlds together because we know it works in the tech space, you know? Like think of the way an app is designed and you know how everything is tactile and all that. All of that thought came from our focus being on the user experience. So if we can use those same concepts and apply it in healthcare, I feel like we could really achieve amazing things by having that type of mindset.
That was interesting because, firstly, healthcare is probably one of the very few industries that is not user-centric. And also, and obviously for those of us who've been working before the pandemic, we knew that there was change that needed to happen in healthcare, but because of the pandemic, it's become sort of exacerbated and part of, the weekly round of news. And so it's interesting to think about, that change management and building that into healthcare where it's like absolutely necessary and critical right now. But how do we, and I don't know, is it because healthcare is just a different monster than the other industries? Is it because of the way that the clinicians and administrators and policymakers, like their thinking is the way that it is and it has always been that way? And so it's a little bit more difficult to make that change. I mean, that was a lot of
I mean,
rambling, but
no, but actually it's interesting because like I really believe that I think what's happening and it's normal. Like I totally understand. Again, you know, when we talk about systems, I think sometimes we have a tendency to think of systems as like as if they just exist. No, there's people
yeah.
behind them. We built them. You know, we built them. Our ancestors built them, you know. So I think it's okay to first of all question them, like, okay, why is it like that? And to figure out the root of how come it came to be, and not from a place of being, you know, not trying to attack it, not in that way, but um just out of curiosity. So my whole thing is we should be more curious about why are things the way they are. Again, not because we want to dismantle everything, but just because we want to understand. And I think if we can do that with curiosity as the reason why we're doing it, we can actually really figure out like, oh, okay, this was like that because back in the day, da 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 reason. But now if we come back to today and say, oh yeah, that doesn't make sense, doesn't fit. And one of those things is, for example, back in the day, and you don't have to go that farther back, just go back maybe 15 years. Patients were not as um, you know, we didn't have the internet the way we do today. So we weren't as informed. So if when I went to a doctor, there was a huge power dynamic,
Mm.
which is completely normal because I didn't have, you know, I didn't study it. I have no idea what I'm talking about. My elbow hurts. You know, I don't know what the medical term for my elbow hurt is, right? But my doctor does. So then it created this dynamic of, well, this person knows everything, and so I'm going to listen, I'm going to follow, and so there was that dynamic. Today, that dynamic still exists, but um, patients are more informed. We can be, if we choose to be more informed, we can go figure out, you know, we can research with proper, obviously proper sources, but there is a way to properly educate yourself on your own and come prepared with questions and ask questions to your doctor. And sometimes I think this is where it gets interesting because there are some people who respond to that as, oh, great, a patient that's informed, this will make my job easier. Or some might
Mm.
find it as a challenge or, you know, but I don't think it should be seen like that. It's just, it should be seen as, hey, we can build a partnership. Like that's my whole thing is, hey, let's build a partnership type of feeling between patients and their providers. Because that's, again, it goes back to that trust thing. Then you're building this two-way street of communication. You can understand one another, you know, where you're at. And I don't know. So all that to say that, you know, I think that's what's really shifted. That now we can build partnerships with our patients, whereas before we didn't have a choice. And now I'm saying we as if I'm a medical professional, which I'm not. But you know, I can understand that. Like I can put myself in their place, understand that how are you supposed to build a partnership with someone that you would first have to educate on so much before they could be at that level, right? But today that's not the case. People, if they want to, they do get themselves educated and come prepared to their appointments, for example, you know?
Yeah.
So
I mean, I think that like we used to think of cancer as a disease of like a people of a certain age, like an older age, but much younger people are starting to get cancer, and these people are, they were born with technology in their hands.
so ultimately I feel like back in the day, it was then, you know, so then it was like I felt like we have a system that's trying to treat the masses more than the individual. So it's
Mhm.
about numbers, like Canada is healthy, X percent, so we're talking about these statistics. And so we might get someone to feel healthy up to this certain level because it fits the checkbox. And then we say, okay, you're done, you're on your own now. And I think it's not, because it's not user centric, it's more like stats centric maybe. But this
Yeah.
is just my perception. Again, this is not, maybe it's not true, but it just feels like that.
Well, and the wrong stats too. Like if you think about when people talk on the news about our healthcare system, they're talking about wait times
Mhm.
for in the ERs or, to see a doctor, but they're not really talking about metrics that really matter to the people who are affected by whatever disease that they have.
Mhm. Yeah, yeah. So it's like the squeaky wheel type of scenario. And we see that in other fields too. So like I don't want to like poop on our medical system because it's like that everywhere. It's because we're human, right? So like I'll give you an example. So I used to work for school boards, I won't name them, um but in Quebec, right? So what I immediately saw was I would sometimes go into these schools that I was like, oh my gosh, how is this school like open? Like what is this? This is like if that's unacceptable, right? And so, but yet because it's a population that doesn't really have a voice, children don't really have a voice, right? They don't vote. So no one's running after to get their votes. So they don't have a voice. And so, but then if you have a pothole in the street and one car gets damaged and it makes the news, then we're gonna fix that street immediately. So it's that also, right? It's about like the squeaky wheel phenomenon, right? So is that pothole really that much more important than like not having drinkable water in a school? Probably not. But the voices that are heard come from the adults whose cars are getting damaged or whatnot. So it's just so there's that too, right? So for example, I mean, there's this thing of I think we're trying to please the masses all the time,
Hmm.
but I don't think that the major problems lie in those common problems, I guess. So that's where but it's tough though. Like I can understand the difficulty. I'm like, yeah, but the noise is coming from there, so we gotta satiate that and then go. You know. So
Yeah,
I
I mean,
it's a dilemma.
there's that similarity between education and healthcare where, they're undervalued and underfunded, and neither one is being prioritized. And like we saw policies like the one in Quebec now that is going to force English universities to increase their tuition for out of province students without thinking about the long-term consequences of the students who would have come to McGill, for example, to be educated, to be doctors or nurses or whatever, engineers, whatever it is that they were going to be, who are no longer coming here, and how that's going to impact our workforce and our capacity, like in research or whatever it is. So there's that lack of prioritization of these really important areas. With your professional hats on, how would you counsel the people making the decisions to change?
So I think these types of conversations really require the different interested, impacted parties to be around the table, but with the condition that we're all coming in with number one, like I was saying before, curiosity. Because oftentimes when we are having discussions in our silos, we tend to create a good guy and a bad guy, right?
Mhm.
So if I'm sitting in a group of just patients, and it's normal, right? Because when there's a problem, we're trying to look for the bad guy to either pin it on them because we can't solve our problem, right? And I get that. It's a very human, natural response. But my way of thinking is like, well, but that doesn't solve my problem. That just makes me feel better for 5 minutes, but I'm still stuck with my problem.
Mhm.
So, but if I go and sit around a table with curiosity at heart, it's like I just want to understand. Like I felt this, and this has happened to me. I'm trying to figure out why. How come? And then I might understand, like from the perspective of I don't know the nurse that's an oncology nurse and might say, yeah, well, actually, we're understaffed, so this and this happens because of so and so reason. Okay, why are you understaffed? So then we keep getting into the whys of trying to understand. But the more people we have around the table, the more we can answer it. And if you notice, at the conference we're at, we did do that in one of the panels, but at one point we hit a roadblock because I think it came down to like the one of the whys, the answer being, oh, it's an ethics board thing. But because in the room we didn't have anybody that serves on the ethics board, we couldn't answer, and the conversation stopped. We were like, oh, we don't have an answer for that, right?
Mm.
So it shows you that if you don't have all the right people in the room, it gets really hard to fix the problem, and then we get into frustration mode, and then nothing gets fixed, right? So again, we have to ask the question, like, who are the interested and impacted parties around a certain problem, and who can we get to, represent those parties in one room and have discussions the way we did at the conference to try to solve problems. That way, first of all, it creates ownership because everybody was involved. So if you do create a solution, then when you publicize it, you're like, hey, we sat down with these parties and everybody's aware. And so we have taken into account everyone's perspective and everyone's motives and everybody's, you know, burdens and shortcomings and whatever. And we've considered everything, and we have co-created the solution. It's not one party imposing it on everyone else. It's not being shoved down people's throats. It's we collaborated and made this, right? So it's easier for then everyone to go and propagate it further and build on it in their own silos when they do go back to their ecosystems.
Yeah.
So that to me is really the key to solving any problem, honestly, whatever the problem
Yeah.
may be.
I'm just wondering because, you were saying that the person from the ethics board wasn't there, so the conversation stopped. But it's not like sometimes it's obvious who needs to be in the room, and sometimes it's not always so obvious. Like somebody from an ethics board, like who would
Yeah.
have thought about? I mean, in
Yeah.
hindsight, yeah, if you're talking about clinical trials, then maybe somebody from an ethics board should have been in the room. But when you're thinking about, like decision makers,
Mhm.
and like they, not that they don't always want to be in the room, but they're also a much more difficult audience to engage with
For sure.
and
Just their
co-create.
availability. Yeah.
Well, yeah,
Mhm.
and just like co-create solutions, because
Yeah.
this is another area where there's a lot of silos in government. So
Mhm.
how do we, and I mean, I'm just asking you as a person with lived experience and, all
Mhm.
these different
Yeah.
hats. So how do we break through to those audiences that, we don't usually engage with
Yeah.
in that type of scenario,
I
let's say.
I think that's a great question, and I think that so like I was telling we talked afterwards on the plane. I was like, honestly, when okay, I'll give you a real example that's not in this space just to demonstrate when it works. Okay, so for example, if um if I give you an example of like for my work, right? So it's a tech space, but within the tech space too, we still have the same models, right? There's governance. So
Hmm.
when you have to go to a project, you have to deal with the executive board, the C-suite, and they're the decision makers, right? Even though they're not the users of the product, right? But they will make some decisions based not on the user need, but based on budget and other priorities or maybe personal priorities, So um, so we do face that kind of issue there as well. But the difference is that we are usually hired, like a team, let's say a team goes in, a change management team goes in, but we're there for a long time. We're there for it's like a year or 2 year project, right? And so there's layers in which we do it. So you have to, yes, sit with, you have to sit with the people up top who are building the vision and the mission to understand just like what's your vision? What do you want to do with this? What's your end goal? So that we already have their buy-in, right? And based out of that, we can then trickle down into, okay, well, that translates to this when it comes to the users. And then you sit with the users and you do the same conversation, but now it's about their user specific daily needs. And then we trickle that back up. And now, so you need these iterations back and forth. Like, so you bring that back up and then you bring that back down many times and it will change and morph into the final product. But this type of work needs like a dedicated team. So if I was to bring this back to healthcare, well, we would need like a project, where we say, okay, here are the engaged parties that we're gonna, talk with. So let's say we did have that conversation with different people around the room, then we would bring that back up to the sponsor, the political sponsor who's sponsoring this project and say, hey, here's what we got. We need you to like work on this with us. So it won't be, we won't take up their whole day. maybe it'll be a short meeting to summarize and brief them. So, there's a method to the madness,
Yeah.
but it requires this iterative process where we go up and down through the whole chain, right? And that takes time. That is not something we can do, even though, workshops are fun, they're great, but they're honestly, they're just starting points. Conversations continue.
Yeah.
Yeah.
Well, change, I think those of us who have been working in this space a long time, we know that change takes a lot of time and it's not going to happen overnight. But
Yeah.
I do like the idea of like this iterative process where, maybe we don't see that so much in
Mhm.
this space.
And I think it's harder too because, like, I've been on a project that lasted 3 years, right? Imagine it lasted 4, but that means in politics, like, when we come to the real world, well, people's terms change, right? It's like
Yeah.
4 years later, it's somebody else. So then the mission and vision might change, and I think that's really hard to deal with. So that for me is like a big dilemma because it's like, well, we're working on something, but then we can completely shift gears and go somewhere else, and everything will be paused. So that's an issue within the way we govern ourselves here, right?
Yeah.
So yeah, that's a whole other thing to add, you know, constraint.
So we got to do everything within like 2 years because we don't have that opportunity to do things within 4 years because like you said, everything can change in that time frame and not just the project is paused, but it could be completely
Mhm.
like
Well,
swept under
that's
the
where
rug.
I think it'd be interesting to have it like something that's sponsored by not the person, but the ministry or whatever. So because the ministry itself, the entity is stable, right? People within it will change, but to anchor, like, what are the goals, long-term goals of the ministry itself?
Yeah, but you would still need to
Mm.
have the buy-in from all the different parties because if a
Yeah,
new government comes in, the ministry
yeah,
could still be like, no, we're not on board with this anymore.
yeah, yeah.
But I just think that that's a really interesting process because, as we were saying earlier, healthcare is not user-centric. It's not user-centric at all. And doing this up and down process would get us to a place that is a little bit more user-centric.
Oh, no, for sure. And there's so many, I feel like there's so many mechanisms now. Like it's just making me think of AI and stuff. But
Well,
I
that was
feel
going
like
to be my next question.
well, because I
So
feel
go
like
for it.
well, because we're at a place where we are talking about shortages and stuff, but the needs are increasing. We have an aging population. We have younger people getting, cancer and things like that. And so perhaps it's not that they're, maybe they're just being diagnosed earlier. It's getting caught earlier, which is good. But then it also means that we're again, adding to the what's the word I'm looking for? To the like the surcharge of the system, right? So we're adding more weight to it, right? Um, so that's a problem, right? Like that's scary to me. It's like what's gonna happen when, as like people in my parents' age, the boomer age group is retiring. That's like a huge volume of people who's gonna be taking care of them, right? And so this is scary, right? But I think this is where we need to kind of embrace technology a bit more. Again, with all of the guidelines and guardrails in place, but I think we won't have a choice but to embrace it. And yeah, so like I feel like there's room for that. I'm always like a little weary of how I present this because I'm not trying to say we're replacing doctors. I'm not trying to replace anyone. I'm not trying to say that the way it is designed at the moment is safe. I don't think it is. It does need work. We do need guidelines around it and standardization and all of that good stuff. But there's potential, And I look at it as like, the first person that invented a hammer. I'm sure people were like, "Oh my God, that's a weapon. You're gonna beat someone with it." It's like, no, no, I built it to build houses, but someone will still choose it to beat someone with it. I'm just saying, right? So it's a tool. Tools can be used. Someone can use it to hurt you. Someone can use it to do good for you. So that at the end lies within the user's hand, but you still need guidelines around it, right? So all that to say, my little my little disclaimer to say that, I actually did use AI and I did use it to ask questions because when I was first given the news that this could be cancer and you're going to meet an oncologist, my world was like flipped upside down and I didn't know anything about ovarian cancer, let alone that there were subtypes and all this stuff. So one of the first things I did was obviously research on Google, but then I also then went to ChatGPT. because I felt that Googling it was actually more overwhelming. Because when you Google something, there's like 10,000 results, and then you don't, it's like so much information. Whereas with ChatGPT, I could like tailor my question and the response I wanted. So, for example, I didn't necessarily want to see like the stats just yet, but I wanted to see what are the questions I should be asking my doctor. And that's literally what I said. I said, what questions should I ask my gynecological oncologist, potential ovarian cancer? And it gave me a list of questions to ask. So, there's a way to get the information I needed without like freaking myself out. So,
Yeah.
so it felt like I had an assistant, like someone
Yeah.
assisting me to have a more informed and conversation where I went into the oncologist and I came out of the room and didn't feel like, oh man, I forgot to ask this, or I wish I had asked that because I already had something guiding me beforehand.
Yeah. It's interesting that you said it was like an assistant, which is really like, you hear a lot of people who, and maybe it's different because you were prepared to, like, you were, before going into your appointment with your oncologist, you were prepared to have that conversation, whereas not everybody, sometimes the patient will sit down in the room and they'll be like, oh, you have cancer, do you have any questions? And so they don't have the time to prepare. But yeah, it's super interesting that you were able to use ChatGPT to ask it the
Mhm.
questions that you should be asking your doctor, because a lot of the times, and we hear like, what should I be asking my oncologist? And people, walk out of there overwhelmed, and a lot of the times they don't hear what they needed to hear. But it was like you're asking AI for the questions, but you're not getting the answers from AI. You're
No,
getting the
exactly.
answers from
The
your doctor,
actual
which
professional.
is,
Yeah.
yeah,
Yeah.
which I think is like a really interesting way to use AI. And we used it on Friday while we were at the airport. I don't remember the question we asked, but I think like some of the input that we got was really good.
Yeah, we asked the question of what are the barriers um, faced by participants um, when clinical trial accrual when specifically within the scope of EDI.
Hmm.
And so it gave like very interesting answers. I
Yeah.
was like, oh, this is a lot of stuff we talked about when we
Yeah,
asked the
it
question.
was actually, it really
Yeah,
was.
yeah.
So, I mean, I think it's interesting. Obviously, I mean, I use AI because I'm just one
I
person.
feel
So
like we're all using it secretly because we don't know that it's okay to say that we are because it's like, the topic it's like a controversial topic right now. But I've actually also now, like, so this is from the patient side, but now from the professional side, like the healthcare professionals, it is now being integrated within their system, their ecosystem too. I have seen, like recordings, like when they're recording their notes, charting and stuff, they're using AI to correct the words that wouldn't make sense,
hmm
because you say something, so but the AI is smart enough to be like, that's not what they said. Whereas if you don't put AI, it just records and writes on what it thinks you said. So
yeah,
it is being used. It is also being used with I think there's a hospital in Montreal that used it, and it was on the news where um it was like hooked up to the patient's vitals or something, and there's something off with their blood or something like that, and it started to ring an alarm. So nurses came to the room and they're like, yeah, but his vitals are fine. Why is it ringing? When they went to go check the notification, it was telling them that something in their blood level was insufficient. Whereas usually there would be no mechanism to detect it. It was because it was hooked up to AI. And they found out that his liver was in the process of starting to fail, but had not reached a level yet that would show up on the regular, usual vital signs. And so they saved this person's life, and I was like, this is amazing.
that
This
is
is a great
amazing.
way that we're showing that if you use AI in the right way with the right, metrics and guidelines and all that, it's super useful.
Yeah.
So
And so so actually I was saying that I use AI just to preface that some of the medical oncologists that I work with are also using AI, and they're,
yeah,
I mean, the conversations that we have not have been about how they're using it in medical practice, but like even writing an abstract, and it has to be like you've got 500 words and you need to get it into 200 words,
yeah,
whereas it would take me like an hour, or take an oncologist maybe half an hour, AI is doing it in, a minute. So
Yeah,
it's,
I feel like it's like an assistant. Like, don't, if you make it do your work, yes, it won't perform that well, and
yeah,
you don't want to, because then how do you trust its sources? You don't know where it's reading. But if you want it to help you think, help you be curious, help you ask the
yeah,
right questions, help
yeah,
you, you know, make something more concise or whatever. I think for that, it's the way it is right now. It's pretty powerful, but of
yeah.
course, it can keep improving and become more safe and all that great stuff.
Yeah, for sure. And I think you said it best during last week's conference about how, it's you need to have guardrails, but you can't put up a wall. So I think that
Yeah.
that is really interesting in AI too. So, and I'm gonna let you say what you like your analogy on the guardrails, because it was really well said, and I didn't want to take that away from you.
No, yeah, it's just this. So the image I have in my head is like, imagine like a narrow pathway, like high up somewhere, and so you need the guardrails because you don't want people to fall off. But we need to start questioning ourselves when we realize like, oh, these guardrails have become walls. You can't, well, for one, you can't see outside what's going on. You're disconnected, and also you're not letting people in anymore, so it's you're losing in both senses. So it's super important to be aware, like, hey, are my guardrails turning into walls that's
Mhm.
preventing me from learning or from others from benefiting from this, right? So
Yeah. And I think AI is one of those areas where, like we have to be careful that we're putting up the guardrails, but that we're not putting up the walls, because it could be a really impactful tool, especially in healthcare.
yeah, yeah, for sure, absolutely. And I'll give you another like really everyday example, like, when you get back your results from whatever test or scan or anything, like, it's like gibberish if you're not from if you're not trained, right? So I would just put that into AI and be like, hey, give it to me in like everyday language, and it
Mhm.
explained it to me, you know?
The conference that we were at Thursday and Friday last week was the Impact Series, and we were talking about EDI, which actually you facilitated, and we were talking about EDI in clinical trials. And I as you were saying that, I just had a thought about, well, couldn't AI be used to create informed consent for clinical trials that is in plain language so that everybody can understand it?
I think one of the tables did mention AI. So the table behind you, there was someone on that table that was like super like AI, let's go,
Yeah.
and a lot of their ideas did involve AI. So I'm excited to read what
Yeah.
they put up. But yeah, but there's so many things, right? Right, like from informed consent, but also within the design of clinical trials, like when so I'm a patient partner with Ovarian Cancer Canada and their patient partner in research program, and it's important to differentiate because even I didn't really fully understand what that meant. So that means that as patient partners, we're not the subjects or the participants of the trial itself, but
Mhm.
we are the people being consulted when they're designing trials. And they're getting our feedback from our patient perspective. Okay. So one thing we always end up giving us feedback is we don't understand what your trial is. When we read your document, I have no idea what I'm reading, and we're encouraging them to like write your stuff, but also have a section that's like kind of like an executive summary, but like in a layman's term server's
Mhm.
summary, where you are explaining what you're doing in everyday language so that anyone with a high school level in education could understand that you don't have to have university level or scientific vocabulary. And so they've started to do that, but what's a challenge, because it's like the curse of knowledge, right? So because people who are within these spaces, they're so used to their language that for them it is every day. So then even sometimes you see their layman summary, it's still very highly technical, and we have to kind of challenge them. And I think that's a great place to use something like AI and actually say like, you know, uh, use everyday words, and it will rewrite it for you, and then you can correct it, and if it misunderstood something. So I think these are again like little places. I think you mentioned it too, like with abstracts and things like that, where you can use AI to simplify something. And I think it's now to tie it back to what we were talking about in the beginning, trust, right? Like if I don't understand what you're saying, how do you want me to sign up for that? But if you use AI to help you make it easier to understand, well, it's a step towards me trusting whatever you're trying to get me to sign up for if you want me to sign up for your trial, right?
Yeah. And so you and I had another interesting conversation at another time, not at this conference, at another, when we had gone out for dinner together, and you talked about how, well, specifically on the topic of trust and clinical trials. And
Mhm.
I don't want to repeat what you said because I just want you to be able to say it, but do you know what I'm referring to? Yeah.
I think so. So I
Yeah.
think one thing that we have to maybe pay more attention to is figuring out like, okay, we know that there's an issue when it comes to trust, specifically when we're talking about getting more diverse participants, different cultures, etc., to participate so that the numbers actually reflect the actual population of Canada. Um, I think the big issue in a lot of, especially when it comes to visible minorities, there's a lot of trust issues when it comes to the medical system because of histories, because of whatever experiences. We all know that there's baggage, and um, and I think that a lot of these communities are still very, very, they still live in a very communal way, and they do have their community leaders, and they, whether it be religious leaders or someone as a figure in their community that's really prominent and that people go to. And I've seen that firsthand happen because when I used to live in New Jersey, actually, my parents, we used to attend the it's kind of like a mosque, um and there were certain people there who was not necessarily the imam, but like there are certain influential people in the community that people would go to for advice, whether it was like financial advice or sometimes health advice of like, hey, what do you think? My doctor is advising this. What do you think? Is it good? Like, am I being used as a guinea pig? Am I being, there's this concern of being used as a guinea pig still embedded in a lot of people's minds because, again, of history and all of that, right? So it made me just, wonder, like, are we talking to these leaders? Are we trying to build relationships with people who we know have direct influence on these various communities? And what would happen if we engaged them and got their buy-in and got them to trust the medical system or the clinical trials or whatever, so that next time someone does go to this uncle or auntie in the community or the pastor or the imam or whoever and said, hey, I'm facing a situation, my doctor's advising this, what do you think? And what if they said, yeah, okay, do this or say this or that prayer, but also, I was recently invited at a conference with all kinds of community leaders, people of different backgrounds, and we were, shown this and that, and it's super promising. I think you should try it. How amazing would that be to also get that as a response if you're coming from that community, and then you feel, okay, well, the person I trust the most said this to me. Okay, now I have this trust built with my doctor too because of this bridge, right? So I feel like there's work to do there. Um, and I really do think it would have a huge impact because I've seen it. I've seen it live happening in front of me where people go to these people in the community and ask them for their advice on super personal matters.
Yeah. But I think it's so important because especially when we're talking about clinical trials and we're talking about, effectiveness of drugs and, we're not all built the same. So we're going to respond differently to different medications or treatments. And it's important to know that. And so in the US, there was some data that came out, and Black women are more likely to be um, diagnosed with triple negative breast cancer. I hope I'm not regurgitating that information wrong. And they're less likely to be tested genetically. They're less likely to be offered the option of being genetically tested.
Wow.
So I just think it's really important. And I think it's also Africans who are more likely to be diagnosed with sickle cell disease. So like you have to know, and like Europeans are more likely to have diabetes. So it's like it's important to know how different people are responding
Yeah.
to different
Yeah,
treatments.
and our personal risks because of our backgrounds, you know.
Yeah, exactly. And so it's important to have all these diverse populations participate in these clinical trials. But it's also important for them not to feel like they're doing this to be the guinea pig for white people, which I think is like really, really important. And I think it's also really important, since we're talking about clinical trials, especially here in Canada, where, it's not going to be a lot of the first in human clinical trials that are happening here. And, if you're being offered a clinical trial, especially if you've been diagnosed with a later stage cancer, then it's likely the best treatment option for you out there. So it's really important for us
Well,
to do that
that's such a big
education.
thing. Like, 'cause it's not like we're like, oh, we're just testing this like for the first time ever,
Yeah,
and like I don't
exactly.
know, you might die. Like and I think that's also where it's important. Like I imagine, like I have like a conference in my head already imagined up. Like I'm gonna just share it with you right now. So like I'm imagining a conference where it's people who are coming from clinical trial, like pharmaceutical medicine nurses, all these folks who are first presenting to an audience that's purposely selected of various influential people within their communities. So, you're inviting pastors, imams, I can't think of the word in Judaism, uh,
Rabbis.
rabbis, thank you. Like, or whoever, like gurus, whoever is their community leader, and they don't have necessarily even have to have that title. Sometimes you just have a very influential person
Like
within the
your
community
tribe,
just
your
because.
tribal chief, or
Yeah, and sometimes it's like it's just a person that everybody flocks to because they're just like the empathetic person of the gang, and people just go to them for their issues, right? And they kind of become like the like the therapist of the group, even though they're not actually, right? So whoever those influential people are within these cultural loops, you invite them to this conference, you share with them like how the system works, um, and once you've shared that, then you go into conversations around tables with them and say, hey, we want to understand, now we've presented this to you. You saw that, it's, for example, a clinical trial. It could take 10 years to come even to a point where we're testing it in a human being. So, we vetted this and all of that before we even touched a person. So with all this knowledge, could we talk about the barriers? Like, what are your concerns as a leader? Do you think, if a doctor approached someone in your community, would they be willing to and then you might get the reasons why there's fears and whatnot. And you might even get from the person in the room saying, I don't believe in that because of
Mhm.
XYZ. And then you can understand the why, like what's going on. Maybe there's something within the belief system that does not allow them to take this
Yeah.
medicine. And
I
we've
was
seen
just
that.
thinking that, yeah, like the
Mm,
Jehovah's Witnesses.
exactly. So it's
Yeah,
understanding all this and how do we work around this and how do we, get the buy-in of the people who are super influential in their communities, because that's where the trust will be built from, honestly.
yeah. Well, that's
And
really interesting.
so like not just going into, like, what you were saying earlier, like not just going and, for example, showing up at a mosque or whatever, or some community event, but like you said, inviting people into the system, saying, hey, we want to listen to you and we want to incorporate what you just said into the way we design clinical trials or into the way we do XYZ or how we offer care, so.
Yeah. I think that would be really interesting. And so it seems this year that health equity is like a major topic for a lot of the pharmaceutical companies. And, coming into this conversation with you today, I was like, I don't know what we're going to talk about. We're just going to talk. We'll see what happens. So I was just going to let the conversation flow. But I feel like we're really finding a flow with the health equity discussion. And I feel that because a lot of people are talking about health equity this year, and like, how do you start? And we talked about the trust, but how do we start building that health equity into our healthcare system? Obviously, I'm not expecting you to answer that, but just, from your perspective, like where do some changes need to happen? What do we need to do? What are the conversations we need to have? How do we need to even think about it? Because, I think you said, and at the start of a conversation, you're talking about thinking about your heart versus jumping into the solution. So,
Yeah, so I think that um it's like something that it's I mean, I know there's no, like you said, it's not one solution, or there's no easy like answer to this, but I do think that it starts with being curious and wanting to understand why that problem exists in the first place, and then from there using our empathy to, like, not only just understanding as from like a factual point of view, but like from the feeling side of it, because often we do make decisions based on how we're feeling about something. It's an emotional decision, and when it comes to our health, like, it's an emotional thing. Like, unless you're going through something, maybe it's hard to understand it. But when someone gets a diagnosis of something that's scary, something like cancer, it's an emotional journey also. It's not just a health journey, it's an emotional journey. It's a whole person's life is just being, exploded in front of them. So, so you do also, I think, have to incorporate that. Okay, well, what could they be feeling? And so, you gave me an example of someone coming into a room and being told, "Hey, you have cancer," like out of the blue, and saying, "Do you have any questions?" They're most likely like shocked and completely
Mm-hmm.
numb in that moment. And so you as a professional are you able to recognize that? Are you able to recognize that their silence does not mean that they don't have questions. Their
Mm-hmm.
silence means that they cannot answer you right now and engage with you right now because their world is exploded. So how do you deal with that, right? Like, do you as a professional say, okay, this person has no questions, my job is done, next patient? Or do you
Yeah.
say, I'm gonna give them a little moment. I'm gonna tell them to come back and see me in a week or in a few days, or call me when they're ready to have more questions, like to go home and to think and to talk. Like, do I bring the human part of me out and connect with them in that moment? And then, so I feel like it's about reconnecting with our hearts really, and it's I think it's something that I feel like it was almost discouraged in medical professionals because like, oh, don't get too invested because it's a lot to take in and it's a burden. But
Mm-hmm.
I think that where we are now, like you we see that that's not true actually, It's not true. When you connect, it's actually it's you create such a positive impact on the person that actually just by connecting, you might help them save their lives.
Yeah.
And and for that to give some credibility to what I just said, like if you go look up Dr. Alia Crum and her research, you'll see what I'm talking about. She's talking about the placebo effect, but she's questioning it. She's like, well, what is it? What's the placebo effect? And she
Mm-hmm.
gets into I think she ends up naming 3 or 4 aspects. It's like, well, one of them is the the environment in which you're having that conversation and the influence it has on the patient sitting in front of you on whether or not they trust you.
Yeah.
So so it's is it is are you creating an environment where the patient comes and feels like, okay, this person actually cares about me in the way they're talking to me, in the way do they look credible? Like, is this it sucks, but is this a resident or is this a full-fledged doctor? But it does have an influence on the person's perception of, am I going to be well taken care of? And if
Yeah.
you just from these few things make them feel that they will be well taken care of, they're going to believe more in a very deep way what you're saying. So if you tell them, "Hey, you're going to do this, you should feel fine in a week or so," they're actually going to deeply integrate that within their system and believe that will happen. And so imagine, if someone goes out, yeah, I'm going to be fine. I trust that person. It's going to help them get better versus someone says like, I don't know what she gave me. I'm not sure about that. I don't know. Like it has impact. And I know it sounds really woo woo, but there's so much research on the impact of our psychology, of our beliefs on
Mm-hmm.
our
Health.
and so and
Yeah.
that's what they're realizing the placebo is because you're giving a sugar pill to someone and they are seeing improvement, but they're like, yeah, but that's just placebo. It's like, yeah, but you still saw an improvement. What is
Yeah.
that? Why?
Yeah.
You know?
Well, so that's really interesting because we were talking about clinical trials and building that trust within communities that may feel racialized. And so imagine that relationship with the healthcare provider and the person who is feeling racialized. If they have already built that trust, then they don't even need to go back to their community and say, do I
Right.
trust this person? Can I trust this person? Should I do this? They already trust the person
Yeah.
who's telling them. And so, I mean, wouldn't that help solve some of our accrual problems in
Mhm.
clinical trials in
Yeah.
Canada and even in North America? Because we do have this accrual problem,
Mhm.
and we are a very diverse population.
Mhm. Yeah. And I to add to that, I think like another aspect is of course like representation. So like
Mhm.
if you have within your team, maybe not it doesn't have to be every single person, but within your team, if you show like you have diverse people working for you, also I think that also creates
Mhm.
trust for that institution, you're like, oh, okay, it's not just like a one type of person that I'm seeing. There's multiple types of ethnicities or cultural backgrounds. Like you feel like you can trust that environment because you assume that they're having conversations, right? So like I'll give you a good example of when I was, in chemo, I decided to buy a recipe book and it was built by the American Cancer Association in collaboration with some nutritionists and stuff like that. And I was getting it more for like, because sometimes it's hard because your taste buds get messed up and everything, and so it's hard to eat and you don't know what to eat for what. Like if you're feeling, I don't know, nauseous, what should you eat and stuff. So it was like a recipe book built for patients receiving chemo and what to eat when and all that. And it was great. The premise was great. And immediately my mind went to if it was someone like my mom's age who was Pakistani, who's going through this, she would not know what to eat because this book is not tailored, like the recipes in there, like she would not eat any of this stuff, right?
Mm-hmm.
So immediately my mind went to like, wouldn't it be interesting? Like, and I used ChatGPT. I was like, and I wrote to ChatGPT like, chemo patient, taste buds, blah blah blah. Like, give me a short recipe, but influenced by South Asian flavors that would, be a good fit for this person. And they gave me some examples. I was like, oh, how interesting. Now, what if I had a nutritionist next to me who could validate if what's written is true just from the ingredients? Like, how interesting would that be? So it just made me think of how important it is to have that representation. So what if you could, if you're a doctor and you could connect your patient and say, oh, I know a nutritionist. Like, what are your eating habits like? Do you eat mostly South Asian or mixed, or like, and the person would say, oh, I eat mostly South Asian. Okay, let me see if I can find a South Asian nutritionist for you, or direct you towards them and connect you, and there you go. So it doesn't necessarily have to be the person sitting in front of you, but maybe that that instinct to ask the question of, hey, would it help you if you had this other specific professional that was from the same background as you or understood those foods well, or
Yeah.
whatever, it's a specific example, but you know what I mean.
Yeah.
Yeah.
So the one aspect, and really the reason that I went to the EDI conference last week was because I'm really interested in the women's health aspect, which we actually didn't talk about at all. Um, and so like, how do you? I mean, I don't know. Like, how do you bring that women's voice into the conversation? I mean, you had a really great experience with your diagnosis, but it's not the same story for everybody. So,
Yeah.
I mean, I don't really know what my question is, but I
No, I
feel
get
like
it.
there's a lot of women who are not being heard. So how do we make sure that they are being heard in this EDI exercise?
I think that unfortunately right now, because okay, from a patient's perspective, like I can't wait for the system to change, right? Like I'm gonna need to, at the moment, unfortunately, the onus is on me to make sure I'm heard. It shouldn't be like that, but it
Hmm.
is. But I can't wait for it to change, right? I mean, what am I going to just wait at home until I get worse, right? So hopefully, when we're having these conversations, it is doing some of that work, right? It's exposing the system to the problem, and hopefully helping it solve it also. But I do think that because our health system is becoming more and more diverse, there are more women than before. I do think that those women are bringing value to the system because they're not just coming in as patients, they're also coming in as the professionals that they are, right? So it's bringing in that those questions that we should be asking, the curiosity from a female body's perspective, right? So when you go into clinical trials, there are more trials being designed. They're asking questions that maybe a male clinical trial, whatever scientist wouldn't have asked, right? Because not because they didn't want to, it's just it's out of just ignorance because they don't know, it's not something they would experience, right? So I don't think there's malice. I think it's been a lot of ignorance, but I feel like now we're at a place where we can say that, well, that's not a good enough excuse, you know. Um, So, but from my perspective, what I would say in like a more concrete way is, while we're waiting for the system to become truly, you know, equitable, um, I do think it's important that if you don't feel like you're being heard, to contact whatever association is related to whatever you're going through. So, like if you're diabetic or if it's ovarian cancer or whatever, if you have some doubts, like contact associations, like look up whatever you are, whatever it is. Like, so whether it's because that's what I did, right? Like I googled ovarian cancer. I immediately got in touch with Ovarian Cancer Canada, and by doing that, I realized that they do have ways of mechanisms to help me, to empower me, and to make my voice louder. And if it doesn't work, then to advocate for me, right? So a lot of organizations do take on that role of helping the patient advocate for themselves or stepping in, right? So I think that sucks because it puts the onus on the patient, but I do want people to know that we do have support. It's just that we don't realize that it exists until we look for it. That's what's up, right?
Yeah.
But
Yeah. So I guess just one final question. With your knowledge and your experience, what would you like to see, or what would you like to do in this space?
I think there's a few things that interest me. So like I think for sure, it's raising awareness of whether it's cancer or whatever it is, to from different perspectives of like, okay, as a young person, as a woman, as a person of color. So first of all, making it okay to talk about it, because I think that's something that we have to get away from hiding everything, because things just get worse when things rot when if you hide them, right? If you have, you like analogies, or you like my images. So if I gave you a tomato and it had a small cut on it, and I just said, hey, I have this tomato, it's got a cut. Maybe you could do something. Maybe you could put a little layer of something on it to repair it, or you could hide it and put it away in a closet. Well, when you come back, it'll be completely rotten and moldy and disgusting, right? So this is just my message of saying, don't hide it. Things often start as small bruises and cuts, but if you hide it, it becomes worse. So talk about it, reach out, ask for help. I think it's brave to do that. I don't think it's a weakness to do that. Um, I think it's because it's harder. So if you're doing the harder thing, you're doing the stronger thing, right? So it's a sign of strength when you talk about it and share your experience. Um, and I feel that the other, so that's from my personal side, but professionally now I'm at that place where I'm like, well, I come from change management. I come from this engineering brain, which is very process oriented, like process mapping and all that stuff. And when I combine these experiences with healthcare, I'm like, oh well, I see it as a big like healthcare change management project. And so wherever I can immerse myself in these conversations, I'm like, yeah, let's do it. Let's talk about this. Let's actually get into, and not just talking about it, but like doing things. And so that's one of my biggest things that I've realized over the last year since my diagnosis was I got really involved in conferences and attending them. And I would feel like during the conference, I would be like, wow, this is so interesting. Look at look at all these brilliant minds behind all this. But then I would also have an idea or a question or something, but there was no room for those conversations because the day would end, you'd all go pack your bags and go home, and you just sit with that, like, okay, great, now I learned something new, but where's the conversation, right?
Mm-hmm.
And so that's also why I approached Myeloma Canada. I was like, oh, it'd be nice if we did like a day 2 where we had a workshop style thing, and and that's where I offered my services to like facilitate it, to see what that would give. And I think it was great because we had different people who were in the room who had the same goal to try to fix a certain problem, and we were having a conversation, not just to inform each other, but to solve a problem. Like we were in solution mode, right? So I think we need to create more of these types of environments where we're getting our hands a bit dirty, and like talking about the hard things, and yeah. So I think that's a starting point. But we
Yeah.
would need a massive like project, I think, to tackle a lot of these issues. like an ongoing project. That's just like anytime something comes in, it's like a task force. And like anytime there's like a tough thing, then we mandate a project and we get people involved and get some ownership so that it doesn't just stay as an idea on a table, but actually turns into something, right?
Yeah. And I mean, I would really love to see you take up more space in this space and use your brain, your engineering brain and your change management brain to create some
Yeah,
of the change that needs to happen.
I would love to work with pharma and be like, hey, like what are your barriers? Like let's build something together and invite the right people in the room and do it. Like that would be something I would love to do and see what
Yeah.
that gives, right?
And so pharma, you heard it here first. Alvina is for hire.
Yeah.
And actually, if anybody's listening and they are interested, I will connect. I will put your well, I'll put whatever you tell me to put in the
Sure.
description box.
Okay.
And yeah, and we'll leave it there. Thank you so much, Alvina, for all the time that you spent with me today, for the
It's always fun.
discussion,
It's hard
for
to
all
stop
the
talking.
discussions we've had. What's that?
I was like, it's always fun. It's hard to stop talking.
I know. I mean, I honestly, I would keep going, but I've got another meeting in 4 minutes. So